Hello, we're back and we're going to be talking more about coding diseases of the circulatory system. We'll get into hypertension, cerebral vascular diseases, and more. And again, as mentioned, we have specific guidelines for all these different types of hypertension. So important to read some of these terms that immediately follow the main term hypertension, as we can see here. And we have other guidelines that talk about intraoperative and post-procedural cerebral vascular accidents, otherwise known as strokes. And we have I-69, which is sequela of a cerebral vascular disease. And we also have codes that get into the health status, namely with the Z86.73. And again, we talked about the type 1 STEMI, non-STEMI, right? Another term that you'll see is documented as non-transmural or subendocardial, but site specified, and whether it's subsequent and other. So again, read very carefully everything that surrounds on both sides of the terms myocardial infarction. There are some additional code notes that you will see in the tabular. And again, as we've seen in other chapters, we want to pick up history of current use and dependence on tobacco. I'm going to talk about the specificity and specific laterality of the blood vessels regarding circulatory diseases. And we want to identify any myocardial infarctions as acute or within a stated duration of 4 weeks or less. And we'll see why in a little bit. With acute rheumatic fever, this is a disease that happens as a secondary cause of strep, and it causes heart damage or inflammation, such as pericarditis, endocarditis, myocarditis, and others. We can have rheumatic chorea, which is basically acute rheumatic fever. And we can have chronic rheumatic disease. So basically, this happens after an initial attack of rheumatic fever and leaves lasting effects that can, in fact, affect all 3 layers of the myocardium and produces a murmur that's very distinct and shows damage to a heart valve. These are the patients that need to have mitral valve surgery, along with aortic valve replacements. Chronic rheumatic disease is coded in I-05 through I-06, I-09, excuse me. And when coding these diseases, look to see the name of the valve: mitral, aortic, both mitral and aortic, right? Tricuspid, pulmonary valves, right? All these things will drive the selection of the correct code. Hypertensive disease, you can find this lumped together with the main terms of hypertension, hypertensive. And the code for hypertension without any other qualification is I-10, right? And this covers essential hypertension, right? We can have hypertension due to a secondary cause like renal disease very commonly also. And there's specific codes and guidelines for that. With hypertension, it's one of our silent killers, as it's been described as, and its complications include left ventricular failure, arteriosclerotic heart disease, retinal hemorrhages, cerebral vascular insufficiency, and renal failure. Benign hypertension remains stable and controlled when it's treated. Malignant hypertension is less common, but it's this kind of abrupt onset and usually results in kidney damage in a life-threatening situation. Hypertensive heart disease is basically hypertension that is affecting the heart. And so as a result, we get this kind of thickening of the left ventricle, the ventricle being the bottom chamber of the heart on the left side. When a patient has heart failure due to hypertension, we need two codes. We need the I-11 for the hypertensive heart disease, and then we need a code for what type of heart failure it is. There's specific sites, and all heart failure is coded to I-50 category. And then what follows after the I-50, after the period, if you will name the specific type, with I-50.9 being unspecified. Hypertensive heart disease presumes a causal relationship between the hypertension and the heart involvement. In other words, what this means is that it's coded as related unless the provider says otherwise. Hypertensive chronic kidney disease is somewhat related, and it's coded to code category I-12. In this case, we're having chronic kidney disease due to hypertension, much like the hypertensive heart disease. And likewise, just like in hypertensive heart disease, we presume a cause and effect relationship. The physician doesn't have to state it. The physician only has to state if that's not the case. The presence of hypertension and chronic kidney disease in a patient is assumed to be hypertensive chronic kidney disease and goes to code category I-12. Chronic kidney disease is not coded as hypertensive if the provider indicates the chronic kidney disease is not related to the hypertension. With the I-12 code for the hypertensive chronic kidney disease, we would also use an additional code, and this is mentioned in the code book from the N18, right? And there's separate codes for each stage of the chronic kidney disease. So important to look for the stage so you know what follows after the N18. Hypertensive heart and chronic kidney disease is I-13. So basically what this is the hypertension, the heart disease due to hypertension and present with chronic kidney disease and hypertension, right? So the important thing when coding these codes for code category I-13 is to look at these three bullet points, whether it is with or without heart failure, and then what stage of the chronic kidney disease, or stage 5 or end stage renal disease, if you will. And then additional codes are required to identify the specific stage of the chronic kidney disease. So to recap, look for with or without heart failure, the stage of the CKD, including end-stage renal disease, and any additional codes, right, for the heart failure if it's present. And again, heart failure without any other qualification would be the unspecified code. We can also have hypertension due to something else, secondary hypertension. And this is hypertension that's due to something else, right? Secondary hypertension, called renovascular, is hypertension due to a renal artery disease. So in other words, the renal artery disease came first, and that's what's causing the hypertension. This is the other side of the chronic kidney disease. In what we looked at earlier, the chronic kidney disease was caused by the hypertension. In this case, the hypertension is caused by renal artery disease. Finally, we have hypertensive crisis, and this is a serious medical emergency coded from I-16. And these are coded with another type of hypertensive disease. In other words, if you use I-16, you should be picking up another code from code categories I-10 to I-15. That's all I have for this time. We'll be coming back for more on coding circulatory diseases and disorders.